Welcome to Wellstar Kennestone Regional Medical Center, where we deliver world-class healthcare. We offer 3 pharmacy residency programs, the PGY1 Pharmacy, the PGY2 Emergency Medicine, and the PGY2 Pain Management and Palliative Care Pharmacy Residency.
The PGY1 residency program at Kennestone started in 2008 with only 1 resident. And through that, leadership has been very supportive of increasing the number of residents as well as adding the PGY2 programs. Residents start out in orientation. During that time, they're rotating through learning our consult service, they're learning the staffing in the main pharmacy. But once they move on to a rotation, they will round each day with an interdisciplinary team on clinical rotations.
I chose Kennestone because it has people who are just really kind. They facilitate a really awesome community. They also have a program that entails vigorous rotations, lots of electives that you can choose from, and it's just been a really awesome time working with the people here. I feel really supported here at Kennestone. There's a lot of opportunities with the preceptors to interact with them. They're really good at making sure that we have what we need. They're always checking up on us. They're really good pharmacists, and so they are expecting a lot of you, but they do it in a way that's respectful of you as a new clinician.
The preceptor and the resident have a really good working relationship. You're not treated as a student when you first start. You are a practicing pharmacist. But there's support along the way to help and get you to that level of independence. When the resident is looking at a PGY2 program, I work with them on their schedule in order to look at the interests that they have. For example, one of our residents has an interest in critical care or emergency medicine, so I've worked on their schedule to have both of those rotations early in the year so that it helps them to make that decision.
The PGY2 Pain Management and Palliative Care Pharmacy Residency is a training program where residents learn to assume the responsibility of pain management related activities in the hospital and the clinic setting. We established this program to improve patient safety and to improve our patient satisfaction with the pain control here in the hospital. But we also felt it was necessary to train more Georgia pharmacists to respond to the opioid crisis in our community. Our residents are involved with assisting our physicians in providing initial recommendations for patients who have opioid use disorder and would like to initiate therapy. Our opioid stewardship program was awarded the American Society of Health System Pharmacists Best Practice Award for our work related to reducing opioid-related adverse events in our hospital, as well as our community education efforts. Each year we have an opioid safety event where we teach our employees and our visitors to our hospital how to recognize opioid overdoses and how to administer naloxone to hopefully save a life.
The reason why I chose pain management was I had a situation with one of my loved ones who was being discharged on home hospice. And part of that involved seeing the nurses, the pharmacists, and physicians that were part of that outpatient palliative care team. Currently, I'm working as the sole resident in the palliative care and pain management program, but I share an office with the other pharmacy residents. My favorite part of the day is spending time in the office with the other co-residents and having a chance to discuss with them about some of our patients. So we get a chance to discuss and learn from each other.
Our residents have an opportunity to work with a team of specialized pharmacists who are responsible for managing the medication therapy for patients with complex pain. And they have the opportunity to collaborate with our palliative medicine fellows. They attend weekly palliative medicine fellowship lectures. Our resident lectures to the fellows and has the opportunity to collaborate on research projects related to the end of life.
The PGY2 Emergency Medicine program is one that is very unique and offers diverse experiences for our residents, including toxicology. I think one of the things that our program does really well is that we have preceptors with a vast array of experiences. Being able to collaborate with pharmacists from other institutions who now work here and create a program that is unique to what we bring to the table has been an amazing experience. We are side by side with our providers and our medical residents every single day. We sit with them day to day, so they're able to turn to us at any opportunity to ask questions, to get feedback, when we're able to provide that day in and day out. We also work closely with our nursing staff, and we are at the bedside with them as they're caring for critical patients, and there again for them to ask questions and be an extra pair of hands if they need it.
The thing that drew me to this program is during interviews, I was just really comfortable with the emergency department, pharmacy personnel, and then during the emergency department, it's very new, it's very modern. Our emergency medicine residency program is at one of the top 25 busiest emergency departments in the nation. For me personally, I really wanted to go somewhere where I was going to see those high acuity patients, so that later on in my career, when I'm the emergency medicine pharmacist taking care of these patients, I've seen it before in training and I'm comfortable taking care of those high acuity patients.
Our emergency department is located across the street from the main hospital. Within that building, we also have a satellite pharmacy. That pharmacy allows us to have a place to prepare stat medications that are needed for patients in the emergency department. When we're not in the satellite, we're out on the floor with the providers. We have 9 emergency department pharmacists here within our hospital, and they all have an opportunity to precept. We see a large variety of disease states, so our residents do get a vast experience.
Wellstar Kennestone is located 30 minutes outside of Atlanta in Marietta, Georgia. Marietta offers the beautiful scenery of Kennesaw Mountain, a vibrant city square where we have boutique shops and restaurants, as well as seasonal events. Marietta is also the home of the Atlanta Braves Stadium, Truist Park. Are you ready to take the next step in your pharmacy career? Apply to one of our pharmacy residency programs today and join us in shaping the future of pharmacy.